introduction to the respiratory course. So during the last decade, the term evidence-based medicine has become the new buzzword. There's a greater need for outcomes and evidence that physiotherapy is of benefit in specific patients with specific problems. So evidence-based medicine involves integrated individual clinical expertise and the best external evidence available from systematic researchers. But with systematic research, it has never been developed or envisaged to be really used for clinical practice. So you might get a big systematic research and you get a very good research study, but it doesn't really, it's very, very difficult in ICU and in this field to do it 100% correctly. When I did my master's in ICU, we couldn't do a lateral, like a covert of patients that get a sham treatment and others that get real treatment, because that will be unethical. So we had to first just take the old things that we normally do, run with that, evaluate that, and then introduce a new system, which is not 100% according to what the level A research is, but that's the best that we could do. Because you can't ethically deny people the correct treatment or just appropriate treatment if you know there's anything better. Some areas of physiotherapy have proven evidence, but there are still many areas of practice which are just anecdotal. And if they say there's no evidence for it, it doesn't mean that it doesn't work. It's just that there's no evidence. And that's another thing that people really need to think about. How do you scrutinize evidence?